So one of the things I'm a big believer in is, just being kind to yourself. And what I mean by that is when you're anxious and you're under stress, like this time is for most of us, I want to I want you to give yourself permission to be anxious. I want you to give yourself permission to feel a little upset. It is appropriate. Like we're in a situation where things have changed so quickly. We're talking about having updates on a daily basis. I think it's important to start to say at this point, if we're, finding ourselves in a tough place, it's important to turn inside and take care of yourself. Someone told me a story once about when you get on an airplane and there's an emergency and the oxygen masks drop down. What did they tell you to do if the most important person in your life, let's say a child or a young person, is sitting next to you, that's your baby? What do you do with the masks? And the response is always you put it on yourself first. And when I think about that, it applies here. I think part of what we need to do is we need to think about if we're going to have to be responsible and taking care of other people, including people in our lives that are older or younger. We have to try to take time for ourselves. We have to try to center ourselves and kind of do the best that we can do. I'm not saying you have to be perfect, but do the best that we can do when we simply start to feel overwhelmed. And I think that means, and I got to come up with a bunch of tips here, but basically exercising, take care of yourself, just deep breathing, and sometimes just having a discussion about how you're feeling. I'm going to talk more about those in a couple of minutes, but those basic concepts are what we're looking for. So, what can stress look like? Well, it can look like a lot of fear. It can look like a lot of worry. It can look like a lot of preoccupation with your health, with the health of loved ones. In particular, with patients, we can see that, and I'm so glad we're having the webinar, that some of these basic questions that you've brought in have been answered tonight. Hopefully, that allies some of those fears. We also think when people get stressed, look for sleep. I mean, I've had a couple of choppy, sleepy nights myself lately, thinking about people that I know, people in the healthcare system that are on the front lines, and thinking just about how, they're going to manage. So that type of sleep disruption is not abnormal either if you're feeling a little bit stressed out. So this tends to worsen, if you have chronic health problems. And that's what I want to make a point on here is don't be surprised if there's like a little bit of a circle that runs around here. So if you have chronic health problems and you're getting stressed, we know that there's a relationship between stress, illness, and chronic illnesses. So we want to try to say if you are suffering from a chronic illness that is not in the best remission status, again, be a little bit more sensitive to yourself. Give yourself a little bit more of that oxygen mask. Try to take care of what's going on with you as best you can. That will help. That also gives you a sense of kind of more control because you're actually doing something or trying to do something. I think the other thing that people do when they are stressed out is they turn to uh, medications of sort, alcohol, tobacco, other drugs. They either try to use these to forget how they're feeling or to manage. And that's something that we have to be cautious for as well. You want to avoid turning to those, quick hits or what I usually call them as numbers, and basically try to kind of take on what your anxiety is about. Try not to kind of hide from it, but let alone do the best job that you can managing. And I think that's what I'm trying to say at that point.